Your life changes in a sentence, like you have cancer.
A lot of people lose hopes, you know, and for people that suddenly have, you know, lost their limbs.
Looking into the future of if I get married and have kids, you know, I'll be able to go outside and play with my children.
Every day, plastic surgery impacts and touches the lives of multiple children and adults.
That's the fundamental difference between plastic surgery and many other specialties.
When you get a sense of a patient and their desire and their energy and their trust and faith in you, I think you bring your A game.
Every case, every patient that we see challenges us to think creatively in new ways and to develop new solutions to problems. That's the essence of plastic surgery.
When I get in the shower, I'm the one who looks. And, you know, not that my body has ever been perfect, but, you know, just normal. Just to be normal.
To see a patient like that who has the courage to take on a difficult operation and recovery from it, I think gets the surgeon excited about just trying to help in the best possible way.
You know, the breast surgeon and the oncologist has made me a cancer survivor, but Dr. Shestak and his plastic surgery team has made me a cancer victor.
It's a great example of how far this field has come, and Pitt Plastic Surgery has played a wonderful role in the development of these techniques over time.
It was a beautiful field of surgery that I wasn't familiar with. The plastic surgery that I was familiar with was Hollywood. And here I was seeing kiddies born with cleft lips and cleft palates and birthmarks and dog bites and so forth. And we were doing something good.
When I kind of looked at what the culture of what I felt Western Pennsylvania and the people who really want to hunker down and go to work, it seemed like a place where we could get things done.
This is gonna sound terrible. You've got to be damn good at it or they won't keep you on.
The early days of what we refer to as Pitt Plastic Surgery, as a lot of these people who were trained by Dr. Dept, Dr. Musgrave, Dr. White, and Dr. Gaisford, and Dr. Hanna, a number of these people left Pittsburgh and assumed leadership roles really throughout the U.S. and likewise throughout the world.
Pitt Plastic Surgery started out as a group of excellent surgeons who got together to teach students a new specialty called plastic surgery. And in the last 64 years, Pitt Plastic Surgery has evolved into one of the premier programs in the world.
Being hospitalized and how I knew it was harder for my family then, because I was in a coma for 8 days and the doctors telling them that they wanted to pull the plug because there was nothing else that they could do. I lost both of my hands and my legs below the knees because of meningococcemia back in 2003. I was very groggy, so it was a little hard to be focused when I first woke up. But looking down and having hands, I said yes, you know, and I have hands.
The hand transplant procedures that our team has performed, including the double hand transplant and the only above elbow transplant in the United States, are only a continuation of what our specialty has always been about. We're not happy with the status quo. We always seek new and innovative answers to problems that have been unsolved until now.
And look at me now, I'm living on my own, you know? Who would have thought it would be that quick for me to jump into that? It's amazing. It really, really is amazing. It's heartwarming.
We had close ties with the faculty who trusted us. Bill Futrell really likes to say it's an ambiance friendly to learning. There was a sense of pride and passion that enabled us to really develop our skills in a way that I think was uncommon in plastic surgery programs around the country. And witness to that is the fact that there are probably 15 or more of the residents have gone on to be chiefs of plastic surgery at various places in the country.
There are multiple reasons for a large number of chiefs and leaders having been trained at Pitt Plastic Surgery. One of them is the strong clinical base that the program attracts people from all over the country for the best education for plastic surgery. The other is a tradition of innovation. It's an institution that's never content with the status quo.
I like to think that people have done things that have been outliers and have been a bit rebellious and always respecting patients and hopefully doing the right thing. But likewise, we just don't accept mediocrity, but we try to push the limits and create the future.
There have been many faculty who have written textbooks and that have made a difference, that have passed on to surgeons not only in America but around the world. There is special insights and expertise that have made a lot of plastic surgery treatments better. So Pitt's had a great tradition in plastic surgery, and I think we're really poised for an outstanding future.
It was a typical day for us in Afghanistan. We're setting out to go on a patrol that morning. I remember turning around and telling my Marine behind me to watch his step. This seems odd. It's a little too quiet here. And as soon as I turned my head back forward to take a step, is when the IED went off. It spun me around, knocked me to the ground, and then from there on, I just remember it being really quiet, that ringing in my ears. My leg felt really warm. I looked down and I could see that all the way down to my bone. I count myself lucky to still have had my leg, but at the same time, it being there and me not being able to use it.
What greater privilege for us than to take care of people like Ron Strang, who are out there putting their lives on the line for us so that we can be safe and risking everything. So to be able to help him restore function with the technologies and techniques that we're developing, that's what plastic surgery is all about.
It was amazing when they even brought up to me saying that this was possible. With regenerative medicine, what they had explained to me was they were going to take, I think it was a pig intestine, and whatever they did with it chemically to break it down, that when they put it into my body would send the signals to it and change it into what it needed. So since it was in next to the muscle that was injured and the muscle that was gone, the signals to that part of my body were saying, turn into muscle, turn into muscle. So I'm kind of the incubator.
It's our research laboratories that really keep us at the frontiers of scientific exploration. We have incredibly talented people working on cutting-edge projects with funding from the NIH, the Department of Defense, and other major sources. And so important to this process are the numerous collaborations that we have with other researchers across the UPMC and the University of Pittsburgh community, including the experts in regenerative medicine at the McGowan Institute.
I brag all the time about what they do and how they are, so they've pretty much given me my life back.
Not only do we have changes in technology and techniques over time in plastic surgery, but with that, we try to evolve new methods of training our residents.
Training programs in plastic surgery usually are a combination of some general surgery and some plastic surgery programs, and we've really been given permission by the accrediting boards and the American Board of Plastic Surgery to have a new, pretty aggressive curriculum that trains just in plastic surgery.
That's part of the evolution of the field. And as we move forward, that's one of the things that we're really trying to do better as well and really try to set an example.
Pitt Plastic Surgery has always been regarded by people in the country as a program that excels at all levels
We have a unique opportunity to take many young trainees and really train them to be the future of plastic surgery. Identify and cultivate surgeon scientists that will really change and shape the future of plastic surgery.
Moving forward into the next phase of pit plastic surgery, a tremendous amount of support is necessary from an interdisciplinary standpoint and from a financial standpoint, and to have the resources of UPMC from the standpoint of its hospital network, the patients, and really the ability to leverage the tremendous collective intellect of surgeons, physicians, PhDs, and other departments throughout the university. That's a special thing.
I knew that this is what they were there for. You know, they were there to help, and I was a person to them, and it made me feel good.
To be able to just wear clothes the way you used to, what a gift. It's an absolute gift.
My guardian angels, that's how that's as close as I can describe them. They really are. It's not even a lie, yeah.
As we move forward with our new Department of Plastic Surgery, I would like to carry forward this tradition of contribution to our field and impact on the lives of our patients, impact on the education of future generations of plastic surgeons, impact on new technology and new techniques that are being used across the country and beyond.